Post my so sharp le bana ba gago Edie Bela, Professor Mataba, and your fellow board member Mike, acting CEO Bomra, Dr. Sima Dijeng, the marketing manager standing in here for the general manager from Botswana Vaccine Institute, Dr. Mazuduma. Bobera de Kanjobulenga, Borra Legoma, a very good morning to you all.
Morning.
Good morning.
Good morning.
Happy New Year. Happy New Year.
It's not Happy New Year,
Happy New Year. Thank you, Director of Ceremonies. We are gathered here this morning for an update on the state of medications in our country following my last update to our Parliament in November of 2022. Kana mutapelare umputse tsa kwa ke tswang tsa kwa ke yang ha ke di itse. The issue of medical supplies in our country has become so topical and critical for our people such that regular updates on the situation has become so necessary in order to keep our people well informed. Director of Ceremonies, my ministry is conscious of the fact that this has taken long, and we have taken a deliberate decision to regularly update the nation on the progress being made on this issue. As an important stakeholder and a key vehicle with which the ministry disseminates information to its various public, it is important that we engage the media as we are hereby doing, which started very well with the tour of the central medical stores. Director of Ceremonies, in my last update on this issue, I did allude to some short-term, medium, and long-term interventions that the ministry was doing to ensure that the country has sufficient supply of medications in all its facilities. Given the dire situation we find ourselves in, it is indeed important that we have short-term interventions that can be deployed while working on the medium and long-term interventions which we believe will ultimately bring these current challenges to an end. Like I alluded to during my last address, I have no doubt that as per the UCCSA hymn number 276, that Motlaonu Waheba, surely it will pass. Director of Ceremony, I did mention during my last address that we had engaged the Baylor College of Medicine, here represented by Mike and Professor Mataba, to assist us to get some of our most required medications a lot quicker. I'm happy to report that since my last address in November, this collaboration with BCM is bearing fruits. The first consignment of the 5 list items comprising mainly cancer medications to the tune of 1.6 million pula has been received and delivered to the facilities. The second batch of cancer medicines with 10 list items at a cost of 5.4 million rands is in order. Another consignment sourced through IDA Foundation, comprising 65 line items, with most commonly used antibiotics, hypertension, diabetes, medication, and other commodities, to the tune of $1.4 million will be air freighted from Netherlands this week and is expected before the end of January 2023. Another consignment, still through BCM, is through a company based in Canada called Apotex, comprising 13 line items of critical cardiovascular medicines and antibiotics to the tune of $1.048 million, which will come by air in the next 2 weeks. We will also be receiving more medicines from IDA Foundation by sea, valued at around $1.09 million by April 2023, which will be the 5th consignment from BCL. Director of Ceremonies, we also have other partners who continue to support my ministry and the people of Botswana in sourcing imported medicines across the world. UNICEF, through a long-standing engagement, continues to assist us with childhood vaccines and other medicines as need be. We are currently awaiting delivery of 2 types of vaccines at a cost of $229,000 in the next 2 weeks. In addition, procurement of 4 types of vaccines at a cost of $1.6 million is ongoing. The United Nations Office for Projects supports my ministry in sourcing TB medications. Between September and November, a consignment worth $28,000 was received. Another consignment worth $38,000 is already at the airport under clearance. Director of Ceremonies, in realizing the dire state of availability of medicines in the country and the challenges with sourcing towards the end of last year, my ministry made an appeal for the second time to our foreign missions through the Ministry of Foreign Affairs to assist with identifying and connecting us with manufacturing companies that could provide us with medicines. It is through this initiative that one company from India called MedWise was identified, and it managed to successfully register 18 products with BOMRA. These products were ordered in October of 2022 to be manufactured for Botswana at a cost of $923,000. A part of this consignment will be air freighted this week and will be received by the end of January 2023. The rest will come by sea in the next 6 to 8 weeks. This consignment comprises a variety of products, including antibiotics, painkillers, and diabetic medications. Ladies and gentlemen, considering that India is one of the largest producers of generic medicines and hence a major exporter of pharmaceuticals, I led a team of experts from the ministry and BOMRA to further explore the Indian market. It was through this visit that a number of companies were approved following inspection of their manufacturing plants. One such aggregator is Hester Biosciences, which managed to have over 90 products exempted. My ministry has just completed procurement of 79 line items comprising diverse products used in our facilities to the tune of $4.5 million US. These medicines and other commodities are expected in April, considering that they will be manufactured for Botswana. Furthermore, as a result of the Ministry of Health and BOMRA team in India, 90 more products from Medwise were also approved by BOMRA, and procurement of critical commodities from this list is at evaluation stage. Director of Ceremonies, our efforts on stabilizing the medicine situation in the country are not only focusing internationally. Procurement of readily available medicines and medical supplies from our local suppliers is ongoing. At the regional level, we've just completed procurement of medicines and other commodities from a South African-based company called New World Industries, with offices in several countries, including India, China, Brazil, and Australia. This is a 56-line item procurement comprising of a variety of medicines and commodities commonly used in inpatient care, including infusions at a cost of 119 million pula. You should know that delivery of these items is expected anytime this week. Director of Ceremonies, it is important to mention that the receiving, warehousing, and distribution of these medicines and medical commodities is done by Botswana Post, as you have seen during the talk. High priority is given to distribution of products to health facilities. On average, Botswana Post takes more than 10 deliveries per day. It is therefore not surprising that CMS availability is kept at minimum levels, with the focus being on keeping healthy stock levels at the facilities. Ladies and gentlemen, one of the initiatives we have aggressively implemented during this difficult time of shortages of medicines was to increase the budget for micro-procurement of medicines for health facilities. This financial year of 2022-2023, to date, health facilities have been allocated a total of 103 million pula to procure medicines on a need basis. I will not talk about the impact of this budget, as I have the HMT coordinators here today who will share their experiences. Director of Ceremonies, I would not want to end my address without mentioning huge challenges related to procurement of medicines and medical commodities, lest it is not construed to be a normal or simple undertaking. The challenge of availability of medicines is a global phenomenon. It is not unique to Botswana. There are, however, specific factors that make Botswana more vulnerable. The lack of pharmaceutical manufacturing locally means we import all our medical commodities. This brings in issues of logistics and supply chain, which were compounded by the COVID-19 pandemic, affecting not only the transportation of commodities, but the actual production of pharmaceuticals. The global and individual country regulatory frameworks for exportation and importation of medical commodities are also barriers to be negotiated during procurement of medicines. The lead time between procurement and receipt of the medicines is also an issue in this regard. Hence, the challenge of being a small population is yet another factor affecting our ability to procure medicines. It is very important to understand that medicines are manufactured on specific orders for specific countries, and manufacturing companies work with quantities. So as Botswana, with our small population, we fail to make enough quantities to interest the manufacturers. Consequently, we're exploring further the use of big companies, which are not only manufacturers, but also aggregators, meaning that they can pull orders from different countries to make the quantities needed for manufacturing as a long-term risk mitigation strategy. I need to also mention the local procurement regulatory framework that does not support efficient procurement of medicines and medical commodities. My ministry is critically analyzing the situation, and recommendations will be made to the relevant authorities in due course. Ladies and gentlemen, the envisioned long-term interventions include luring these medication manufacturers to come and set up in Botswana. We all know of Nantworks, which will be coming through this year to do this manufacturing. Currently, the main challenge is that there are no medication manufacturing companies in Botswana. Hence, BVI is here. They will share that story with you, for it is one of the solutions that we need as a country to correct this once and for all. As I've already said and demonstrated, the subject of pharmaceutical shortage is not just about procurement of such. It's also about disease prevention, early diagnosis, and hence timely management of illnesses, and the rational use of pharmaceuticals where required. To reduce the volume of people needing medications and impact on pharmaceutical shortage, my ministry has decided to concentrate on primary health care revitalization. This should reduce disease prevalence and hence the volume or quantity of medications required to manage diseases. I have therefore decided to improve on clinical case management. This should introduce lifestyle changes and modifications that will prevent and minimize diseases and conditions such as obesity, diabetes, hypertension, and complications of such diseases, among others. Ladies and gentlemen, the art of medicine and clinical excellence is a lifelong learning and ongoing self-motivated pursuit of knowledge and the application of such knowledge. For this reason, I've decided to solicit the knowledge and experience of clinical expertise available in the country to expand and improve on clinical case management. Therefore, a number of specialists will soon be working with the ministry to reduce various backlogs, provide guidance and mentoring of clinicians in the public sector. Director of Ceremonies, ladies and gentlemen, in spite of all, I want to assure all Botswana that the issue of medication supply will remain our topmost priority. The current stock levels at facilities show that we are stabilizing. Hence, we anticipate a normal situation in future. As a long-term strategy, CMS will be using local framework contracts to manage procurement of medical commodities. To date, 2 framework tenders have been awarded which contain critical medicines. The 3rd framework tender is at cooling period, while some are in progress. My ministry will closely monitor availability of medicines, and if there are challenges, this will be addressed in a timely manner, including, as alluded above, the engagement of international aggregators. My ministry remains committed to ensure that the nation receives medications in our facilities as prescribed. Surely, Mutaunu Wahida. Director of Ceremonies, research has shown that the best yardstick to assess the quality of healthcare services is not customer satisfaction, but customer experience. Challenges with supply of commodities contributed negatively to our customers' experience. As a ministry that endeavors to transform customer experience, I cannot overemphasize the need for a motivated and well-resourced workforce. Mentorship is key to realizing this goal. My ministry will work on quality mentorship programs that will not only give our customers a great experience, but will have positive implications on our workforce's career prospects. This is key to sustainability of everything I have deliberated on today. I thank you for your attention, ladies and gentlemen. Apulele net.